So we looked at the factors that affects the clinical trial enrollment success rate. So as you know, clinical trials are a vital part of any kind of cancer research to strengthen any treatment options. And almost like 20% ish clinical trials fail due to basically problem with enrollment rates. And we define the enrollment success rates as greater than 85% or more of whatever there was estimated enrollment. And we found out that certain factors, for example, the activation year, or study design, or the lead sponsor agencies, or the primary or secondary endpoints, or the number of enrollments, those are the things that determine the success rates of a clinical trial. So basically, we saw we got data from the clinical trial gov, and we almost got 29,000 clinical trials, and then we excluded those clinical trials based on the included those based on the intervention studies and those who had the results within December of 2023. So basically, and then we excluded those studies. We got mostly 2,000 or more, some more than 2,000 clinical trials, and we found out that almost the phase 3 clinical trials those clinical trials have the most enrollment success rates, and also regarding the sponsor agency. Mostly the industry sponsor agencies, those do better than NIH or other academic institutions, mostly because of the funding, because of cutting edge technologies. The other thing is also the primary endpoint. For example, if we see that there are more than primary and secondary endpoints, more than 2 or 3, those studies we have more data, and those do better on the enrollment success rates. And sometimes we do single center studies, sometimes multi-center studies, sometimes multinational studies. The multinationals and multi-center studies, probably greater than 5 sites, are doing better enrollment success than those who have less than 5 or 3 sites. And lastly, who have less than 50 patients, enrollment patients, those are doing better than better than the studies that have greater than 50 or greater than 200, basically. And I think our study basically suggests that there are variabilities based on those factors, and we can focus on those factors to basically increase our enrollment success rate.